At Prescriptions Pharmacy, we offer a care home service which we believe is second to none. We aim to provide a personalised service to each and every care home. We understand that each care home has different needs, and we tailor our service to meet the needs of each care home specifically. We operate a monitored dosing system, or MDS, known as Biodose. Biodose is the most innovative and forward-thinking MDS system which is available at the moment. Not only does it allow solid dose tablet medication or capsule medication to be included in the packs as a normal MDS system would, it is also the first MDS system which allows liquid doses to be placed into the packs as well. This means that there is no secondary dispensing for the care home of liquid medication. And it really is pushing the boundaries with regards to medication administration in care homes. This is a Biodose tray. The tray is in a 28-day format as a normal MDS system would be. However, the tray is much better and contains a lot more information than a standard MDS system would do. On the front of the tray, we have a photograph of the patient. This makes it very easy for any agency staff which may be coming to the care home to administer medication, because they may not know who the patient is, they may have never seen the patient before, and the photograph on the front of the tray helps them to easily and efficiently identify the patient. As well as the photograph, we have the name of the patient, the room number, ward number, or any other information that the home deems relevant. We also have the date of birth, we have their doctor details, and we have our pharmacy details also. Each tray consists of a series of pods which contain the medication. To administer a dosage, you do what we call pop a pod. So literally you push a pod out for that dose time, and this is now your final dosage vessel with which you will administer the medication to the patient. On the top of the pod we have the name of the patient. We also have, again, a room number or a first line of an address or whatever the care home wishes to be under. We have a list of the medication which is contained within the pod. We have the time at which the dose is to be taken, and we also have the date at which the dose is to be taken. The pod is completely tamper evident. Once the seal is removed, it cannot be replaced, and it is also impregnated with an MRSA dependent microparticle. To administer a dose, you simply remove the seal and pass the pod to the patient to take the medication. There is no need to place the tablets into another dosage cup to take the patient, which helps to reduce the waste that the care home has. As well as having the tablet or capsule medication within the pod, the significant benefit of Biodose is that it can also hold liquids, as you can see here. So not only is it sealed, the seal is completely airtight and holds in any water or any liquid. Again, this means that there is no secondary dispensing by the care home into a spoon or a vessel for the patient to take. It also frees up a lot of storage space for the care home, because you no longer have to store bottles of lactulose or Gaviscon or whatever it may be. All the medication, all the liquid medication that you require is held within the pod for the patient. It also means that there are no dosing errors, because the pods, the medication within the pods, are pre-measured by the pharmacy using expert equipment. We provide MAR charts as standard. So a standard MAR chart that we would provide with the Biodose system would look like this. We have a photograph of the patient. We have the patient's name, date of birth, doctor's details. We have the medication they're taking, a standard MAR format, but as well as this we have the images of the medications on the MAR sheet, so carers can identify the medication if they need to. As well as a MAR sheet, we provide what we call a patient information chart, or a pick sheet. Now the pick sheet again has a photograph of the patient and is basically a summary sheet of everything that the patient is on, the patient themselves and everything the patient is on. It has a photograph of the patient on the top corner. It has a name and address, date of birth, doctor's details, a list of medication, larger images of each of the medication, the dosage directions, and then a summary of the mark sheet of when the dosage should be taken. All of our care homes find this a very, very useful tool, and it's something that we provide as a standard with the Biodose system. Another very useful product we supply with the Biodose is the Handy Pack. Now the Handy Pack is essentially a holder of 4 pods. This means that the care home or the patient can take away medication without having to take a tray full of medication with them. This is really revolutionary that patients are able to leave the home and take a day's worth of doses or a single dosage with them when they go. And again, each pod contains relevant information such as the patient name, the medication which is within the pod, and the date and time at which it should be taken. Because the pods are completely airtight, this means that medication that normally would not be dispensed into MDS can now be dispensed into the Biodose system. This includes medications such as Depakote, Epilim, quetiapine, medication that normally would not go into the MDS, and the care home would have to keep separate boxes. So you can see with the system how we're saving the care homes a lot of storage space. If you would like any further information on our care home services, or if you would like us to come and see you and provide you with a free demonstration of the system that we use, then please feel free to contact us either via email or you can call us on our telephone number. The Biodose system isn't limited to care homes and is also used in domiciliary care. We provide the system to lots of domiciliary care agencies, and we would encourage anybody to contact us, and again we would come and provide a free demonstration of the system and go through how it can be beneficial to the care service.